I'd like to just join with Paul in welcoming you all and thanking you all for your attendance today. Veronica's already introduced me, so I won't talk to that. We'll just go on to the next slide, because I'm here today to talk to you about the Victorian Cancer Plan, which was released earlier this year and in September, and it sets out the government's policy and reform agenda. Underpinning the new cancer plan are 5 core principles which identify and focus our efforts on ensuring Victorians have the best outcomes and experiences of cancer care. And for this particular event, I'd just like to draw your attention to 3 of these principles in particular: quality and safe care and evidence-informed care. And I think just keep that in mind. Underpinning the plan is also some long-term visions and goals which build on those that were set out in the original 2016 plan. And it also retains the 5 action areas that were in that initial plan, from primary prevention through to research. There are a couple of things that are new. There's the addition of some short and medium-term goals, as well as there's been a work to implicitly or explicitly link the steps of the pathway to the optimal care pathways, so that they're linked and embedded throughout the document, as we see the OCPs as one of our key reform assets, I guess. So what are the optimal care pathways? I'm sure many of you are aware of them, and they set out the key principles for the key steps of the pathway of care. And they reflect and embed emerging areas of optimal practice, whether that be supportive care or timeframes or, informed financial consent, whatever it might be. They were developed by multidisciplinary groups of experts, and they've gone through a rigorous and extensive consultation with the sector, including peak bodies, professional groups, and so forth. And then they have gone through an endorsement process with national interjurisdictional groups, as well as being endorsed by peak Australian cancer control agencies, including Cancer Australia and Cancer Council Australia. And they have been designed to be useful for all people involved in the system of care in cancer. And just a side note that they're being currently refreshed, and you'll see that these visuals cite them as the 2nd edition. Just as a short digression, this is a slide from Professor Bob Thomas, who many of you will know, which just reminds us that the care pathways, the OCPs, are not clinical practice guidelines, but they are about the organisation, about describing the organisation, processes, policy development and creation of a framework or system of care. And they need to be viewed in that regard. Next slide is our Cancer Reform Program implementation framework, which is led or directed by the Cancer Plan. And there's a whole program of work which is centred around the OCPs. And when we talk about the optimal care pathways, we're actually talking about all of you here: patients, clinicians, healthcare administrators. Everybody has a part to play in delivering a system of care. And the reform agenda starts with measurement of the system against the OCPs, which again is what you're going to be doing here today, where the OCPs provide us with a clear guide of what should be as against what, it gives us a definition of what to compare what is. And there's a range of stakeholders and initiatives and resources which have been created to support this reform program, and they're identified here on this slide. And, it's critical to identify on the side there that there are those of you here today engaging in a tumour summit, and that we hope that that will be paired with service improvement. As Paul indicated, the Tumour Summits program is actually now quite mature, having evolved since 2014. And at each of the steps it's been refined, having been reviewed. So it's a program of work that starts with a summit, such as today, and a lot of collective discussion and a focus on potential achievable and meaningful work for improvement that can be done at a statewide level, that is, can only really be done at a statewide level, alongside potentially local improvements. This work has progressed over a period of time, and then we follow up with a repeat summit at some point in the future where we measure and monitor the change so that we know whether or not we've got where we wanted to get to and what more needs to be done. And monitoring, measuring and monitoring is critical. As Paul said, the data isn't always perfect, but we are working with what we've got. And if you waited for perfect, you'd never make a start. And measurement and monitoring comes back to the cancer plan, where we've set out these goals, short and long term, as well as the overarching long-term goals. Achievement of these is going to take collective and coordinated and sustained effort across the sector. And the Tumour Summits contribute to that. So as you deliberate today, please keep in mind what would make a meaningful difference. What is the scale of change that's needed? And keep in mind that we need to be able to measure and monitor what it is that we're doing, so that when we come back in 2 or 3 years' time, we will have some sense of whether or not we've made any change. And then just in closing, there are lots of people that make a summit like this successful. As Paul said, it's an experiment today being virtual, but I'd like to just acknowledge those people, and in particular the Clinical Working Party, because they've done the hard work and sifted through the data so that we can have a very meaningful discussion here today. Thank you.